Hello friends, welcome to part 2 of cardiomyopathy. So in part 2 of cardiomyopathy, we are going to discuss with the causes of cardiomyopathy, its pathophysiology and its signs and symptoms. So let's start with the etiology of cardiomyopathy. So first cause for the cardiomyopathy is idiopathic. It means 50% cases of cardiomyopathy have been unknown. Okay, there is no research have been done. Okay, so 50% cases of heart disease like cardiomyopathy or some other form of disease have been unknown. Next we have genetic. Genetic means when there is some change, when there is some mutation in the genes, then what will happen? It will go into the upcoming generation. It will transmit into the other generation. Means from first parent to the next generation, or it can skip into third parents also. Okay, when there is defect in both the genes, then what will happen? It will definitely go into the upcoming generation. And if there is defect in single genes, means if there is defect in the father gene only, then also it can go into the other generation. Next we have high blood pressure. It means the BP which is more than 120/80. So high BP create an extra workload on the heart. So heart have to maintain this high blood pressure. If this high blood pressure will go for a long time, then what will happen? The heart have to do its contraction and relaxation process in a very rapid manner for outflow of the blood from this chamber. Okay, so if this high blood pressure will go for a long time, then heart muscles have to do extra work. It have to pump out the extra blood from its chamber, and after some time what will happen? Those muscles will go into some changing process, or there will be some remodeling in the heart muscles, or there is structural changes in the heart muscles, which is called as cardiomyopathy. Next we have ischemia. Ischemia means a condition where there is a low oxygen and nutrition supply in the blood. Okay, if someone is suffering from coronary artery disease, so what happens in coronary artery? There is atherosclerosis formation, or there is a plaque formation in the coronary arteries. So if there is plaque formation, if there is rupture in the plaque, so what will happen? The heart muscles will not able to get sufficient amount of blood and oxygen. Okay, blood rich oxygen. Then what will happen? The heart muscles will die, or they will get apoptosis of the heart muscle. There will be apoptosis, means death of the muscles. Then there will some scar formation in the heart muscles also, and that is called as restrictive cardiomyopathy. Next we have long-term alcohol and tobacco. Okay, long-term alcoholic condition creates a high blood pressure, and high blood pressure creates an extra workload on the heart. And one more thing, much amount of drinking alcohol, or long-term exposure of alcohol, or long-term drinking of alcohol create a thiamine deficiency, and thiamine is needed for our cell for the release of ATP form of energy. Okay, so our heart is working in a working for each and every second, and it needs a lot of energy for its function. So what will happen? If someone is drinking too much alcohol, then it will create a thiamine deficiency in the cells. Okay, in the cardiac cells, and there will be no energy formation in the cardiac cells, and our cardiac cells, our myocyte will be die, and there will be some dystrophy or dysfunction in our cardiac cells. Next we have tobacco. Tobacco have a chemical that is called as nicotine. And nicotine is very toxic for our coronary artery, because this nicotine substance damages the endothelial lining of the coronary artery, which will again create a low blood supply to our myocardium muscles or myocardium cells. And again there will be scar formation, or there will some dystrophy in the cardiac muscle cells. Again the heart will go into the restrictive cardiomyopathy. Next we have autoimmune disease. So autoimmune disease condition means when our immune cells are triggering, okay, when our immune cells triggering to our own organs. Like for our heart, if our immune cells are interacting, or they are triggering with our cardiac cells, then what will happen? There will be inflammation, there will be fibrosis formation in our cardiac cells. And due to this immunity, due to this autoimmune disease condition, a chemical is released which is called as cytokine, because this cytokine tries to suppress or tries to release out this interference. But what happens? Due to extra release of cytokines, they can damage our muscles, our cardiac cells. Next we have chemotherapy and radiation. Chemotherapy drugs like for example doxorubicin. Okay, doxorubicin drugs is very harmful for our cardiac cells. They create an extra workload on our cardiac cells. So doxorubicin is very harmful for our cardiac or myocardial cells. And due to radiation, if suppose someone is having lung cancer, so what happens radiation? We are treating for lung cancer, but behind the lungs we have heart. Okay, so that radiation will directly go into our heart cells. Okay, those radiations are going into our heart cells and they will create or they will cause a death of our cell. That is called as apoptosis of our cardiac cells. It means death of the cardiac cells. Next we have hemochromatosis. Hemo means iron. If there is extra iron get deposited into the heart muscles, okay, if suppose the intestine have absorbed a lot of iron and it will flow into our bloodstream and go into each and every organ, and it also goes into our heart. So what will happen? Due to extra iron deposition, the heart will not able to perform its function in proper way. Okay, the ATP form of energy will be not able to release in a proper way, and due to this extra iron, there will be some metabolism restriction. There will be cell metabolism restriction because of extra iron have been deposited into the cardiac cells or myocyte cells. Okay, and heart will not able to perform its function in a very well manner. Next we have amyloidosis and sarcoidosis. Amyloids means proteins. If extra protein have been deposited into our cardiac cell, then those extra protein creates a rigidness and stiffness in the heart muscles. Okay, and due to that stiffness and rigidness, our heart will not able to dilate in a proper way and blood will not able to fill properly. So it is called as restrictive cardiomyopathy. Due to extra protein deposition, due to extra protein have been deposited into our cardiac cells, into our muscles, there will be some stiffness or rigidness formation in our heart cells. Next we have sarcoidosis. Sarcoidosis means when there is some granuloma or scar formation in our lungs or heart, then it is called as sarcoidosis condition, which again create a cardiomyopathy condition. Next we have thiamine. Due to low vitamin and minerals, the cells of our heart will not able to form ATP form of energy which is required for the heart. Okay, so every organs need our energy. So our cells create an energy in the form of ATP. If there is low deficiency of vitamin B1 thiamine, then what will happen? The cell will not able to create ATP, adenosine triphosphate energy, and our heart will not able to get sufficient amount of energy for the work. Next we have heart valve problem. If someone is suffering from heart valve problem, okay, suppose if there is stenosis in the aortic or pulmonary valve, then what will happen? Due to stenosis means due to narrowness of the valve, the chambers have been filled with the blood. Okay, suppose chambers is having the blood, but there is stenosis or there is narrowness in the valve, then what will happen? Heart have to do extra work. Heart have to do extra effort for the forceful extraction of the blood from that chamber. Okay, or suppose we can say the example, if there is regurgitation in the valve, then what will happen? Due to regurgitation, the extra blood will backward flow into the chamber and there will be dilation and weakness in the chamber because of extra blood. Okay, because of extra blood have been accumulated in the chamber because of regurgitation condition, backflow of the blood in the same chamber. Next we have muscular dystrophy. So muscular dystrophy happens due to the autoimmune disease. Okay, so what happens? Our heart need a protein that is called as troponin or myosin protein. So when there is some genetic or some mutation in the troponin or myosin protein, then what will happen? The heart structure, function, contractility will not able to form properly because there is some autoimmune disease or there is some genetic changes in that troponin protein. So troponin protein is required for our heart structure and for its function. And due to age condition also, there is weakness and degeneration happens in the muscles. Or if for a long time we are following a sedentary lifestyle, we are not doing any physical activity, then also the muscles will get degenerated and there will be weakness in the muscles, which will create a cardiomegaly condition, cardiomyopathy condition in the heart chambers. So next we are going to discuss with the pathophysiology of cardiomyopathy. So in part first of this video, we have read three types of cardiomyopathy. Number one is dilated cardiomyopathy, number two is hypertrophic cardiomyopathy, and number third is restrictive form of cardiomyopathy. But there are several forms of cardiomyopathy also present, like Tukosubo cardiomyopathy, right ventricular arrhythmogenic cardiomyopathy, chemotherapy-induced cardiomyopathy, and pregnancy-induced cardiomyopathy. But mainly three types of cardiomyopathy which are main. I am discussing only those pathophysiology. If you want a combined pathophysiology video of cardiomyopathy, then you can comment me in your comment box. I will make a separate video for that. Okay, so I am starting with the pathophysiology of dilated cardiomyopathy. So due to etiological factors, so whatever causes are there for cardiomyopathy, like if there is genetic cause, there is metabolic disorder, hypertension, diabetes, or there is some autoimmune disease condition. So whatever there are causes for the cardiomyopathy, it will damage our muscles layer. It will damage the myocardium of muscles. Okay, how? Myocardial muscles damage leading to thinning and stretching of heart walls. So due to the causes, our myocardial muscles will become stretched out. Okay, so in this diagram I have shown the left ventricle have been stretched out. Okay, so why I am taking the left ventricle only? Because the left ventricle do a more function in our body, and there are several cases in which the patient have suffered from left ventricular cardiomyopathy only. Okay, so this cardiomyopathy can happen in any chamber of our heart. Okay, so I am discussing with the left ventricular dilation. So due to the etiological factors, our left ventricle wall have been stretched out, it have been dilated. So what happens when this wall becomes stretched? Okay, if the wall is dilating or it is stretching out, it is expanding out, then the layer of that muscles will become very thin. Okay, so due to this stretching of this ventricular wall, the muscles layer have been become very thin. It is looked like a balloon shaped structure, or we can say that it is looked like a banana shaped structure. So next what will happen? There will be impaired contractility systolic failure. Okay, if a rubber band have been stretched many times, then what will happen? Once that rubber band will lose its elasticity. Okay, so same thing is happening in our heart. Okay, due to the degeneration, due to thinning and stretching, this ventricle chamber have lost its elasticity. Okay, now the blood will not able to go out from this chamber. There is systolic failure, means there is contraction failure. Okay, blood is coming in this chamber. Okay, blood is coming in this chamber, but due to the stretching and dilation, the muscles is not able to contract. Okay, the muscle is not able to pump out this blood out from the ventricle. So there is systolic failure happens in the dilated cardiomyopathy. There is contraction failure, and one more thing is happening here. Because there is expansion of this ventricle, there is a huge space in this ventricle, so a more blood will fill up in this ventricle. A more blood is filling in this ventricle. Okay, and this type of cardiomyopathy is also known as congested form of cardiomyopathy. As you can see in this diagram, the more blood is filling in this chamber. Okay, so it is called as congested form of cardiomyopathy. So due to systolic failure, due to less contraction, what will happen? Our neurohormonal system will activate. Okay, so if there is no cardiac output is going out, then our vital organs will be depleted of oxygen and nutrition. Okay, so our important vital organs or our body will not able to receive the proper amount of blood because there is very less cardiac output. So because of this reason, our neurohormonal system will get activate, like our SNS system, sympathetic nervous system will activate, and there is one more system will activate, that is called as RAS system. Okay, renin angiotensin aldosterone system, it will also activate, and it will retain the water in the body, and because of retention of more water in the body, there will be more amount of blood is formed. Okay, and there is more overload, the heart will feel. Okay, and due to the sympathetic nervous system activation, the heart ventricle have more pressure. Now heart ventricle have to do work in a more contractile way. Okay, there is a more pressure generated in this ventricle. So due to this more pressure generated in the ventricles, what will happen? There will be remodeling in the heart chambers. Okay, so next, cardiac remodeling and stresses of blood in ventricles. Obviously, when there is neurohormonal activation, it will create a pressure on the ventricles, it will create a pressure on the heart for maintaining the cardiac output. Then our heart will automatically go into the remodeling process, into the remodeling phase, and this chamber will become more dilated and there will be more filling of this blood. And ultimately what will happen? This blood will go back into the backward direction. They will fill into the lungs, into our whole body. There will be congestion in the lungs also, and there is edema seen in the body also. Next, we have heart failure and cardiomegaly. Ultimately what will happen? The heart will not able to fulfill the body demand, and and due to the neurohormonal activation, it will go into the more cardiac workout process. So the heart will give up. Okay, the heart will give up its activity and it will go into cardiomegaly, or we can say that it will go into the heart failure. Next, we are going to discuss with the pathophysiology of hypertrophic cardiomyopathy. Okay, so hypertrophic means the cell size increasing. Okay, the cell size has been increasing. There is hypertrophy and there is hyperplasia. There are two terms. Okay, hyperplasia means when the cells are multiplying, like in cancer. Okay, from 1 to 2, there is a binary system in the cell. Okay, so that is called hyperplasia. If the number of the cells are increasing, okay, if the number of cells are increasing, that is called as hyperplasia, and if the size of cells is increasing, that is called hypertrophic. So what happens in hypertrophic cardiomyopathy? Due to etiology. So the main etiology for hypertrophic cardiomyopathy is genetic mutation in the sarcomere protein. Sarcomere protein is essential for the muscles. Okay, the muscles are formed through the sarcomere protein. So whatever causes are there for hypertrophic, the main cause is genetic. Due to genetic mutations, what will happen? Thickened intraventricular septum and ventricular wall. There will be thickness in ventricular wall and in septum region also. So I am making this diagram again. So in hypertrophic cardiomyopathy, what is happening? Okay, so in hypertrophic cardiomyopathy, there is thickening. Okay, there is thickening in the ventricle region. Okay, so these cells are hypertrophied, and this septum region have been also hypertrophied. Okay, this septum region, the walls, the muscular wall in between the ventricles or atrium. Okay, so this septum have been hypertrophied. So again, what will happen? There will be diastolic dysfunction. Okay, how there will be diastolic dysfunction? Now you all know that there are two types of hypertrophic cardiomyopathy. One is obstructed cardiomyopathy, other is non-obstructed cardiomyopathy. So what happens in obstructed cardiomyopathy? Why we call it obstructed? Because this septum is creating an obstruction. This septum is creating a huddle in between aortic valve and in between the mitral valve. Okay, so if the ventricle will try to push this blood out, so due to the septum, there is an obstruction in the pathway. Okay, there is obstruction in the pathway. So this hypertrophy may happen in the upper region of the septum. Okay, so this septum region will be hypertrophied at the mitral valve and at the aortic valve region. So there is obstruction in the main pathway, and other is called as non-obstructed. If there is no thickening in the septum region, there is only thickening in the ventricle region, then it is called as non-obstructed hypertrophied. Okay, so due to this obstruction also, the chamber size have been reduced. There are two things happening. One is the less blood is filling in this less chamber. Okay, the chamber size has been reduced, so there will be less amount of blood will be filled in this small chamber. And second thing, the ventricles are not able to relax in a proper way. There is a diastolic failure. Diastole means when there is blood filling in the chamber, that is called as diastole. So due to the hypertrophic of these muscles, the chamber size has been small, there is hypertrophy in this ventricle, and there will be less filling in this ventricle. This ventricle is not able to relax in a proper way and there will be less filling. Okay, next, impaired ventricular filling. Okay, ventricles are filling less, and obstruction causes decreased outflow. As two things happening. One is there is less amount of blood is coming into this ventricle, and other region the less amount of blood is going out. Okay, because these ventricles are very thick, very stiff, very hard, they are not able to contract in a proper way and not able to eject out this blood out from the ventricle. So main problems comes into the diastolic dysfunction. When less blood will fill in the ventricle, then less amount of cardiac output will generate. Okay, there will be less cardiac output. Next, decreased cardiac output and sudden cardiac death. Obviously there will be less cardiac output, our body will not able to get enough amount of blood supply, and ultimately there will be sudden cardiac death. So next we are going to discuss with the pathophysiology of restrictive cardiomyopathy. So as the name suggests, there is restrictive cardiomyopathy, means there is some hardness, there is some stiffness in the ventricles or in the chamber of the heart. So due to etiological factors or due to any causes, like if there is amyloidosis, means if there is protein deposition, or if there is iron deposition, hematochromatosis, or due to chemotherapy or due to radiation therapy, the muscles fiber have been scarred, there is a scar formation in the muscles of the heart. Okay, so due to the hardness and stiffness of this ventricle chamber, what will happen? Diastole dysfunction, there will be relaxation problem. Okay, diastole means when there is filling of blood into the chambers of our heart, when the heart goes into relaxation phase, that is called as diastolic phase. So due to this hardness, due to this scar formation, the diastole will the heart chamber will not able to relax properly, and there will be less amount of blood will be filled in this chamber. So due to this due to the scar formation, the ventricle is not able to relax in a proper way, so there will be less filling in this chamber. Now what will happen? The less amount of blood is going into this ventricle, but the blood which is coming into the atrium, it will again remain in this atrium only, and this blood will go back into the atrium again. Okay, and from the atrium it will go into the lungs, there will be congestion in the lungs, and because accumulation of blood, the blood is going back into the atrium, our atrium will get dilated, there is dilation in our atrium, and from the right atrium the blood will go into the systemic circulation into our whole body, and there will be ascites seen in the abdomen, there will be hepatomegaly, or there will be swelling in our whole body. Okay, so there is diastolic function, there is relaxation problem in the chamber of the heart. So ultimately decrease cardiac output. So when there is no blood is filling in this chamber, then the cardiac output or cardiac ejection will be very less. So dear friends, I am not discussing signs and symptoms in this video. I will make a separate video for the signs and symptoms. Okay, so if you really like this channel, so please like, share, subscribe for more new medical or nursing videos. Thank you.